So, good evening, everybody. Welcome to Atlantic Institute's dialogue discussion on COVID-19 and what to do if you get it. We have a couple of guest speakers here, but it's kind of still a community dialogue discussion. We have Philip Kent on the line here from the COVID Consortium, and we also have Alicia and Scout, from California, and they're going to share as well some of their experience with us. And we might have one or two other people get on that will share another experience that they had with the coronavirus. And then we can always ask some questions and answers. So we are providing this discussion because we kind of felt that it was important for everybody to understand what to do, like some knowledge on how to handle this, like if and when you get this, would be a great thing. And so we figured the best thing for us to do was to have some dialogue from some people that have had it and recovered and what it felt like and what helped them, what they did or didn't do. One of our coworkers that used to work before us in Charleston also had this. 7 of her family members had it. And she was not able to be on the call tonight, but she did message me her story so I could read it to everybody. So I figured after we hear from everybody else, I can go ahead and do that too. So if we can go ahead and hear from Alicia and Scout, like their story of what happened to them. And then maybe we can hear from Philip Kent from the COVID Consortium after that. And then we can open up to questions and answers. I think that might be a good outline for the night, if that works.
Sounds good.
Sure. So where do you want us to start? At the very beginning or what?
Like how we contracted it?
Sure. Whatever knowledge you have, that'd be great.
Okay, so we'll try to keep that brief. So we had been textbook being careful. My sister was living with us at the time, and she is a nurse who works with immunocompromised patients. She works with cancer patients. So we were taking all the precautions, avoiding going out in public, not hanging out with friends and family, just doing everything that we should have done. In mid-June, as everything started to kind of like, we're like, well, this is our life now.
It was right when California started opening up pretty much. It was, I think, 2 weeks after, and we were like, well, things haven't been spiking. So
we had a friend who had left the country for a few months, and he got stuck over in Kazakhstan. And so he was able to finally come back at that point. And so we had a small get-together with 5 couples, and 3 of the 5 couples ended up testing positive. We had a little get-together outside. We're pretty sure we contracted it during that time because we all got sick around the same time.
But we were told beforehand that all these other couples were being extremely safe like we were. So we figured, well, if they're being safe too and we're being safe, it should be okay. Mm-hmm. But I guess we were wrong.
Yeah. One of the couples, they were the ones who tested first, so we don't know if they were the ones who infected everybody else or if it was just a timing thing, but they were mostly asymptomatic. They got tested randomly because they went to urgent care and they asked them if they wanted to test. They came up positive. They gave us a call and we were like, you know what, we've already been sick. Like we're already feeling it.
So we went on that trip. It was a Friday through Sunday. And then on Tuesday, Alicia started feeling pretty terrible. She was laid up in bed all day, coughing. You're just feeling like
sleeping,
she
headache.
Had pretty much every single COVID symptom except for the fever. So she went into urgent care. This was at the beginning of June. She went into your doctor.
I went to my primary doctor.
And she went to go get tested, and they asked all the questions. Are you experiencing these symptoms, those symptoms? She's like, yes, yes, yes. And they said, are you having a fever? She said, no. And they're like, oh, okay, well, you probably just have a cold or something.
Allergies. They told me I had allergies.
You probably just have allergies. They didn't even offer to give her a test.
Even though I told them I don't have any history of allergies. Yeah. He said, well, allergies can develop later in life. And I said, well, I need to know if I have COVID because, I could put my sister at risk and all of her patients. And they flat out denied me a test. Yeah. So a few days went by, kept feeling worse and worse, and eventually went down to the free county testing site and unsurprisingly did come back positive at that point.
I think it was 3 days after she went to go originally try to get tested. We found out that other couple had come up positive. So then we're like, okay, well, we probably have COVID too. So then we went to the county testing facility. And then it took 6 days for the results to come back, 7 days. So by the time the results came back, we were mostly over the bulk of it. We were still having residual symptoms, but before we even came up COVID positive, Like that whole time we were infectious, so we could have been out doing things, and this would have been anybody else. We could have been infecting the public or doing whatever. It just took so long to get the results back. It was kind of crazy, I thought.
But we knew,
Yeah,
like we knew in our heart of hearts, and it's like, even if you don't know, just the fact that we thought we might have it, we did not leave our home. We had groceries delivered. We didn't want to take any chances. But something that I keep telling people is that if you don't have a fever, that is not the be all end all. And I don't know why it is, because out of all the people I know who have had COVID, none of them have had a fever. So I'm not sure I understand, the screening at doctor's offices, stores, places of business, whatever, where they ask you if you have a fever. Like, yes, that can be a great indicator, but the problem is healthcare providers are also using that to disqualify you from being a potential COVID diagnosis. So, we just keep telling people, like, if you don't have a fever, don't let it go. If you're having every other symptom.
We never had coughs either. She had coughs on the first day, but then after that she was good for about 2 or 3 days, and then the symptoms started coming back again, but there was never a cough again. I never had a cough the whole time I had it.
Mm-hmm.
So it's like the symptoms vary from person to person so much.
Mm-hmm.
But I think the loss of taste and smell is kind of the definitive one.
Unfortunately, though, for us, that is something that came
midway through.
Yeah, like halfway through our illness. I would say it was at least a week before we were like, hold on a second. Like, things don't taste right. I can't smell anything. So that's not a good early indicator. It's a pretty solid indicator, because anecdotally, everybody that we know who's had it has definitely lost their taste and smell, but have not had a fever. And I think that's pretty interesting.
I still can't smell anything. It's 2.5 months out now since we contracted it.
Mm-hmm.
I could never smell very well before, but now I still can smell nothing. Weird.
And that sounds like a minor inconvenience, but I'll say, as far as especially eating food, without being able to taste food, textures feel strange. You lose your appetite, because all your favorite foods, if you think about the texture of foods, they're very odd without the flavor. So I realized the only thing I could really stomach was like ice cream and applesauce. So kind of, I've told people who have come down positive, like, hey, you need to get like some soft, creamy foods to eat, because, French fries are going to taste weird. Hamburgers are going to be weird, chicken, all that. So something with, a good creamy texture that's not going to gross you out.
What I find interesting is that I've had some friends that were sick, and they said they felt like they had all the symptoms, but they either tested negative and I said, you know what, I think that maybe the definitive symptom is that sense of loss of smell and loss of taste, because that's like, doesn't seem like it's in anything else. And I've often wondered, that must be the really funky thing to not.
You lose your sense of taste or smell when you have a cold and you're congested. It does not compare. It is the strangest thing I've experienced in my life.
It completely goes away.
It's just bizarre. I know you were talking about people that didn't test positive, but they had all the symptoms. So oddly enough, my sister, the nurse, about a week after we got sick, she started showing symptoms much more severe than us. They pulled her off of work, presumed positive. She tested 5 times, negative every single time. Negative for antibodies. Every single symptom that we had, she had 10 times worse. And we still haven't been able to figure that out. That's a bit confusing.
At one point, she felt like she was going to pass out because she was so short of breath. So she tried to go to urgent care, and on the way, she was getting lightheaded. So she just went to the ER. And when she went into the ER, she told them, like, hey, I live with COVID patients, or people have come up COVID positive. I haven't come up COVID positive yet, but I've had all the symptoms. I'm feeling shortness of breath. Is there anything you can do? And they're like, okay, let me see what we can do. And she waited outside for, I think, 2.5 hours.
Yeah, they wouldn't let her
hours.
inside the facility.
They just never let her in. They never helped her. I think they pulled up her test results probably, and they're like, well, she's come up COVID negative. This is probably just like a hypochondriac, somebody who just thinks they have COVID, maybe a crazy person, I don't know. And they refused her care, which I think that'd be a terrible position to be in, feeling like you have all the COVID symptoms, but for some reason you're coming up negative on the tests. Like, it messed with their head quite a bit.
I think that is also something that we've been telling people. If you think you have it, just assume you have it, because that's not an uncommon story. I've seen lots of that online with people having all the symptoms. There's been multiple counts of people, testing negative multiple times and then testing positive for antibodies. So that's something important to keep in mind, that like, even if your test comes back negative, if you feel like you have COVID, act like you have COVID. Stay home, order your groceries, order your food, stay away from people.
Yeah, my 4-year-old, like 3 days ago, came up in the morning and he said, "Hi, good morning," and he started sniffling, and I was like, "You sound like you have a little head cold," and I was like, "Back to your room, back to bed. Let's get some hydration. Let's get some stuff." And I was like, "Nope, we're not going anywhere." I canceled a group I had Tuesday night, and I canceled another group thing that I was doing Wednesday night, and I was like, "Nope, we're not going." I said, because the rule of thumb right now is like, if you're not feeling well, stay home. And I'm like, so we're just gonna stay home and just make sure we're all pretty. I think he's 4, so I think they pick up some of those things. But I was like, nope, not going anywhere, because if anything gets worse and I have to worry about anything getting worse, then well, at least we've been home.
Yeah. So just to touch a little bit on like our symptoms and experience, and like the advice that we would give to the people who will end up contracting it at some point. There's a lot of misconceptions out there that, if you're young and healthy, you're fine. I'm 35, he's 25. We're healthy, active, normal weight, no underlying conditions, no hypertension, no diabetes, nothing, none of those things that are, there's this misconception of like, well, you have to have another contributing factor for it to hit you. It knocked me down harder than anything in my life, including childbirth. It took me longer to recover from COVID than it did from squeezing a 9-pound baby out of my body. So it's not, a walk in the park. And obviously it has been for some people. Of course, there's asymptomatic people, but like, I think people in our age range, especially right now, have a very false sense of security that, I'm young and healthy, I'm going to be fine. He was knocked down harder than I've ever seen him be sick. I mean, typically he'll get a cold and snap out of it the next day.
Usually when I'm sick, it's like, I think the longest I've ever been sick is 3 days. I usually just have a day cold and then it's gone. But with this, I was knocked on my butt for a solid 7 days before I started feeling a little bit better. And during those 7 days, it was just like extreme body ache, major fatigue, worse fatigue than I've ever had. I just felt super lazy, like even getting up to get a glass of water. And it was like, oh,
exhausting.
I'm ready for a nap now. It was just super tiring. And then I think about 3 days in, I started getting minor shortness of breath, and that progressed for the next 4 days. And then after that, it started tapering off. But when the shortness of breath started coming in, that's where it starts to get a little bit scary, because you're like, am I getting shortness of breath? And the next day, it's just a little bit worse. And you're like, uh-oh, seems like it's getting worse. That's not good. And then you start thinking, because at the time, all you were hearing about was COVID deaths increasing and stuff like that when we had it. And that's all you hear. You don't hear about the people recovering from it. So you're like, oh, well, I'm getting more shortness of breath, and all I'm hearing about is people dying from COVID. This is getting scary, and it kind of messes with your head. You're like, oh, am I going to die from this? And it just kept getting worse over about 3 days, and then it kind of stayed the same, and then it tapered off, luckily.
I would definitely suggest that if you come down with it, stay off of news, social media, etc. while you're trying to recover. It was bad for my mental health. Every little thing that you feel, you're Googling, and then you're reading stories about this person who had it. And I just don't feel that's conducive to healing. The number one thing that I think helped us eventually kick it is we listened to our bodies, and we're like, you know what? We've got to lay in bed all day. Like, yeah, there's things to do, and we could clean up the house, and we should cook instead of ordering food. But we laid in bed, and we got up to shower, and that was pretty much it. We just stuck to ourselves and let our bodies rest and recover.
I used a lot of Dayquil. I found that helped me a lot. That got me through most days, just taking Dayquil every 4 hours. But she said I was taking too much. I was following the instructions, so I don't know.
Well, the problem with Dayquil is that it contains acetaminophen, and it seems that they're unsure whether or not they would recommend the acetaminophen versus the ibuprofen. I stuck to ibuprofen for the most part.
At that point, I'd researched it, and I think it said that it was either or was okay. I know in the beginning they were kind of 50-50 about it. But yeah, Dayquil helped me a lot.
That's the hard thing about this is, like, with it being so new, there's so much conflicting information. There's so many anecdotal stories about there. If you had somebody else sitting beside us, they would have a completely different experience and like what worked for them and how they felt. And I think that it's overwhelming to absorb all that information and try to apply that to, like, once you're sick, you're kind of in panic mode, even though you know realistically, like, I knew in the back of my mind, like, we're gonna get through this. Like, we're gonna be just fine. Like, we're gonna feel like garbage, but it's gonna go away. We're gonna take care of ourselves. But it is something that kind of, like he's saying, nags in the back of your mind. And you start thinking, well, what if we don't? And so I think kind of not just isolating yourself physically, but kind of isolating yourself mentally from outside, like, forces that could stress your body out. For decades we've been told, like, stress is bad for your physical health, not just your mental health. And it's a time when your body's going through a lot to try to recover from COVID. So it is important to take care of your mental health as well.
All right, good. Thank you. Philip, I wanted to see if you could, we can come back and ask you guys some questions. I know you're sitting in your car over there, and I wanted to just see if you could introduce yourself and what it is that you guys do, so that we could learn and learn what you've been doing. And you're on mute. If you could unmute.
Sorry.
That's okay.
Yeah, thanks for having me. COVID Consortium is the name of our business. And even prior to COVID-19, we were involved in the molecular lab space. So doing a lot of genetic testing and things like that. Some of the same machines and reagents and chemicals are used for that are used with the COVID-19 testing. I'm more or less like the external affairs director for the group. I feel like I have a pretty unique perspective. My entire family had COVID-19, even my little 3-year-old. And we're around a lot of people, particularly on test sites, that share their experience, their symptoms, and everybody's been, not everybody, but there's a lot of obviously different reactions and a lot of anxieties, and some people that just simply didn't even know they had it, a lot of asymptomatic situations, and then of course the ones that were really bad and turned out bad. I guess I can start with me, and then I'll get into a little more of the company, what the company does. For me, it was early on, and so I can relate to the couple that was talking just before me, in February, and I was at I believe that I contracted it through the UK consulate, one of their meetings in Atlanta, and of course the wave was there first and it hadn't come here yet, and of course we were hearing about it over here quite a bit, and more or less for me it was more of an anxiety because I felt like I was the first person in Georgia to actually have this, and I was like, okay, this could be really bad. So for me it was just not sleeping, wondering what was going to happen next. But fortunately it was a cough for about a month and runny nose, and that was about it. My wife has a pre-existing, so I was terrified when I found out, because I was very safe to try to stay away from her when I found out. She actually got it later, believe it or not. It was very, very strange, outside of the period when you would think that she would get it for me. So I suspect that actually she got it from someone else. But I was terrified for her when she did get it. And she, all of her symptoms from her underlying condition came out pretty quickly. Thankfully, she got through it, and it doesn't seem like there's any lasting issues other than the taste and smell. And she's really worried because it's been a couple months and it still hasn't quite come back yet. And she's a cook, and a very good one. And it really bothers her. But that's kind of my story, my experience personally from the COVID Consortium perspective. What we do is we do a couple of things. So we'll have test sites. You've heard of the drive-throughs; they're all over the place. We manage those places, and so we do anywhere from 900 to 2,500 tests a day at specific sites, all different types. The gold standard, we believe, still is the PCR test. You hear about the false positives, which are not good, and you hear a lot about false negatives with testing. The rapid testing, while it seems like a really good idea and you can get a result pretty quickly, a lot of those tests really were not designed for mass use or high capacity. They were primarily designed for like strep tests in physician offices or in hospitals, maybe running 10, 20 at max, 30 a day. And a lot of those machines are being pushed pretty hard, up into the 150, 200, 300 tests a day. And I like to use the analogy, it's kind of like the old record players, which most people don't have anymore. But on those old record players, the more you played music, the needle would wear down. And that's kind of my best analogy for some of the rapid machines. I think there is definitely a place for them, so not completely putting them down. I think it's how they're used is what's important. If you use it because you need a quick result on the spot and you are a positive, most places that use this say, hey, go get a second test using PCR, which again is the gold standard, getting that swab, that nasal swab, that oral pharyngeal swab. And of course, you've seen the spittoons that come out where you do saliva tests. One of those running through PCR is going to give you the most specificity, the most accuracy on the test to verify whether or not you have it. Antibodies similar. There's the rapid test. There's a high percent error, 30 upwards of 50. I've heard in the beginning it was even higher. There's some good manufacturers of it. Again, I think they can be used as a good indicator for a quick look at what the person might be experiencing, but then backing it up and waiting for actual lab results through a serology test, actual blood draw using a vial, and finding out for sure, kind of what your antibody situation is. Antibodies tests should not replace a PCR test. Actually looking for the actual virus in your body. Stop me if you guys already know all this stuff, but I'm just kind of sharing what we're doing at this consortium.
I was gonna say I don't know what that is. I know that there's the nasal test, and I know some people have had a throat swab, but I was curious which one was more effective.
Yeah, so there's a lot of studies that have gone around back and forth between that. At the end of the day, there's been pretty good data that's come out on the oral pharyngeal and the nasal pharyngeal, which oral, throat, nasal cavity. If you do both of those right, and the collector does those right and really gets down there deep, and for the nose, it really kind of needs to make you cry. If you don't cry when they do it, meaning tear up, then you probably didn't get deep enough in the nose. And the throat, you have to have a gag reflex. If you didn't have a gag reflex, most of the time you're not getting in there. So if you're having false negatives and things like that, it's typically the collector that hasn't done the collection process right. Typically, not always. As far as the comparison between the two, I think that it's pretty close. I mean, it came out originally that the nose was it. That's the one you need to do. The throat just didn't collect enough of the viral load or the specimen that you needed. If it's done correctly, really the specificity and effective, it's very, very close. So I wouldn't discount one over the other. Even the saliva, the spittoon spitting into it, at first, it was kind of like that's kind of a last resort. It's a convenience because obviously people can spit into a cup better than they can swab themselves effectively. And so for that kind of application, it makes a lot of sense. There's a place for it. And it's been found that it actually is doing a very good job using the PCR model again, because there's a new spittoon that came out from Yale, or a new emergency use authorization that came out just a couple of days ago that takes out part of the process of resulting the saliva. I'd say we're still looking at that one. The verdict is still out, but the traditional PCR spittoon saliva test has turned out to be actually very effective. So all three of those are very good.
Philip, what is PCR?
Yeah, so it's a crazy word, and I will not pronounce it right, but it's like a Latin type. You can pull it up. I'm not going to try to even pronounce it, and never have been able to even since I started doing this. It's an acronym, but if you guys Google it real quick, you can see it. It's sort of a long word, 3 words, obviously. But you can see that is really still the gold standard. Nothing has really dethroned that yet, even with all the rapid tests that are out there.
Thank you.
Sure. Rather than that, going out to businesses have actually been somewhat neglected in the fact that, as was mentioned earlier, it's very hard sometimes to get tests covered, particularly if you're asymptomatic. and that's probably by design. And you know, early on there was a fear that hospitals would be overrun and that capacity for testing would be an issue. That is a legitimate fear. Looking at past breakouts of various different viruses, that has become a concern. And so I think that has always been sort of the narrative that has been the narrative that wanted to be projected early on. Our perspective, though, however, is if you're attempting to get past this wave and trying to open up the economy and do it in a safe way, you have to have more testing, and businesses need to be able to have access to them directly, so that, number one, they can, you know, there's two sides to every coin, but litigation is a major issue with businesses that, you know, a lot of times they're scared to open up because they don't know what they're bringing through the doors as far as the virus and people that have it. And so they need to be able to do their due diligence through testing if they're going to open the doors and keep the doors open, if that's their philosophy. And so for those businesses, we try to help them do that in a safe way. And again, the only way to do that really is to have some sort of testing regimen. That really isn't available through the state. At least it wasn't early on. We sort of brought that to the forefront and made that available. We feel like it's made a really big impact. It's helped employees who have a lot of concern about going back to work, particularly the ones that have underlying conditions and the ones that are a little bit older in age. So that's the other side of what I would say the consortium has brought to the table.
Very interesting. Thank you very much for sharing.
I just want to touch on something that you said real quick about the testing and really getting in there. So something strange.
I gotta jump out for a second. Dory, I was gonna ask if you can unmute yourself and just help host. I know you've helped host in the past. I just have to step out the kids with something for a minute. So I was gonna ask you to unmute, and I figured you can handle this. You're good at this. So can you just help moderate and host, and I will be back in a few minutes.
I'd be glad to. You bet.
Thank you.
Thank you for asking.
So we have, well, I have two children, age 11 and 7. And when we first realized we were sick, you know, we tried to do our best to keep the kids away from us on the other side of the house. But, you know, with little ones, I would wake up from an afternoon nap and my 7-year-old would be laying in bed with me in my face. And I'm like, what are you doing? Get out of here. So we tried to keep them from getting sick. We did end up getting them tested as soon as we got our positive results. Neither one of them had symptoms, but my 11-year-old came up positive and the 7-year-old came up negative, which left us kind of dumbfounded because, you know, 7-year-olds are a lot more clingy than, you know, 11-year-olds. He spends a lot of time hanging all over us in our faces. And
they were both exposed just as much
yeah,
as each other. There was no difference. Right?
Yeah, they were both here the whole time. And so anyway, when he came up negative, I was like, I don't know that I trust that. So I did go to have him retested because I thought maybe he had tested too early. Hadn't quite had the viral load in his system yet. But when I went for the retest, I was kind of flabbergasted at how flippantly they tested him. It didn't make him wince. He was saying, you know, you've pretty much got to cry. And that was my experience. It's like, it feels like they're scrubbing your brain, and that's how it should feel to make sure they're really getting in there. And he barely even winced. You know, they barely put the tip right inside his nostril. And I wanted to say to the tester, get up in there. I need to know, you know, if he's had it for my own peace of mind. But, you know, of course that one came up negative, I presume, because, you know, he probably wasn't tested properly. So the next step for us is going to be the antibody testing. Not that it really changes, you know, how we live right now, because we're still being as careful as possible. But now I'm working in a long-term care facility, working directly with exclusively COVID patients. So we're at a high risk for being infected again. And so now that's something that it is on our minds, because, you know, you hear like, once you get it, you're good, you know, you're fine, you'll be good for a while. And now we're second guessing everything, because every day when I leave my house, I'm putting my family at risk.
We're like a real life science experiment now, seeing if you can get reinfected.
Yeah, if anybody was going to get reinfected, it absolutely would be me. I'm working in a long-term care facility with direct patient care where everybody in my wing has tested positive, and it's spreading like wildfire. It's frightening. Like, you read all the stories about it, but I was off for 2 days and I came back and we had 21 new positives just in the residents, aka patients, not including staff. Now, we only have 81 beds. So we had 16 positive the day I left. We added 21 the day I came back. If you do the math, that's almost half of our entire facility. And the staff is dropping like flies too, because it is a interesting situation, because once you test positive and you're already working directly with COVID patients, as long as you're not too sick to work, they will have you keep working because you're already infected. And you know, it's kind of the devil, you know, it's like, well, you're going to let this person go home if they're asymptomatic and they're okay to work. But now we're bringing in somebody else who hasn't tested positive, and realistically, they're going to now test positive because you're so close and personal with these patients, even with full PPE, face shields, N95s, gowns, the entire shift. Like, you're pretty much going to contract it. And so it's a little frightening to be in this situation again.
How did you handle that with your children when you both were down for the count with it? Did you have anybody else who could help care for them, or were you good enough, healthy enough where you could manage food and manage them?
So luckily, well, not luckily, I guess. So he's actually not their father, and I have a co-parenting relationship with their father. We assumed that their father and stepmom would have gotten it as well, just from passing the kids back and forth before we realized we were sick. They tested, they came up negative, which is a great case for kids, not asymptomatic children, not being super spreaders, because they were literally going back and forth between households. I mean, we were utterly shocked that they didn't get it. So when the one child came up positive, she stayed with us, and the child that was negative went with them.
So as soon as we got our results back, not even when we got our results back, when we found out that our friend had tested positive for COVID, the one that we were exposed to, we immediately sent them over to their dad's house, and they stayed there the whole time until they stayed there the whole time.
Until April came up positive.
And then they both got tested while they were over there. And then once their results came back, we found out that April was positive. So she was allowed to come back here because we were positive, she was positive. So we're like, all right, she at least gets to see one of her kids, because she was having a hard time with that being away from them for, what was it, 2 weeks? 2 weeks, 3 weeks?
Yeah.
Then we had to wait another week and a half or so to get the other one back. But yeah, we tried to be as safe as possible about that.
Wow. Thank you for sharing that. What a way to manage, huh?
Yeah, it's crazy.
Any other questions?
Who else on here has already had it? Anybody else? No. Okay. Okay.
Is there anything else that you want to share about having it?
Yeah. So
We can give you guys a little survival list just for your notes.
So like one thing I said to Dayquil that helped me a lot get through it. We're over here in California, so cannabis is legal over here. I found, oddly enough, cannabis helped me a lot get through it. Like I'm not all into like hippy dippy medical stuff, but it did help alleviate the body ache a lot, and it opened up my lungs when I was having shortness of breath. It allowed me to breathe better. So that helped. I know everyone doesn't have access to that, but if you do and you're open to
They're
it.
in South Carolina.
Yeah, in Georgia. I know,
It's
but
different.
anyone else watching this, possibly.
Yeah.
It seemed to help me a lot. So
Which it seems counterintuitive to inhale smoke when you've got a lung disease. But he's right. It did help, because the body aches are pretty intense. Just not being able to get comfortable, and we're just flipping and tossing and turning in bed, trying to find a comfortable position.
it also helped taste food also, just in the slightest amount, which was kind of interesting. I thought, like, I don't know, it was weird.
Yeah.
What else?
Powerades. We had soup. We ate a lot of soup, like I was saying, like things with a smooth, easy texture. Avoiding crunchy foods. Crunchy was kind of gross, and
That's all
yeah.
optional though.
Well,
Up to the person.
yeah, I was just saying. But, obviously staying hydrated as best as you can, which I had some recurring nausea during that. So it wasn't always the easiest to drink water. So it was a little easier to drink something like Powerade, which is good because it'll replenish your electrolytes especially if you're having like a fever and sweating a lot. So that helped quite a bit. And then obviously your standard like crackers, dry food, things to settle your stomach.
Did you all actually feel good enough to be able to go online and order your foods and have them delivered?
Fortunately, yes. Yeah. I know that like in the grand scheme of things, we had a relatively mild case, especially when you take into account people who are older or compromised in some way. So I am thankful that we were able to do those things for ourselves. But I've noticed a lot of people, once they know that you are positive, we had so many people offering to drop food off for us. And, you know, if there's anything we can do for you, we'll send you dinner, we can drop off groceries. And luckily there's been a great sense of community when somebody does come up sick, especially once you've had it. Now I see my friends post on social media that they have it. I say, hey, I've been there. Like, what do you need? Like, we'll take care of you. We can drop things off for you or run errands, whatever you need done. And that's something that's important to remember is like people close to you start coming up positive is just be like a good support system for people, because it is not only physically draining, but it's mentally draining, and it takes a lot out of you just to take care of yourself when you have it. Having something that's so new and unknown it's just wild. And I know this is probably a gross generalization or comparison, but he was saying like it was almost like on a very slight scale what the first HIV patients must have felt like when the information is conflicting and there's not a lot of research and there's no long-term studies. Like, we still don't know like how this is going to affect us in the future. Like, my memory is still completely thrown off, and I had like started losing my memory while I was sick and kind of assumed it would come back as I got better. And I still have major problems with just remembering like minor tasks that I was supposed to do or conversations I had with people. And that's not something I anticipated at all.
My memory's fine though, which is kind of weird. So it varies from person to person. You were also having what, neurological stuff, right? You said your fingers were.
Oh yeah, the finger and toe like numbness and tingling, and that is something that's when I started to kind of freak out a little bit. Like, oh, this is neurological. This is not a cough or a cold.
This was way after though. The initial,
this was weeks after I tested
this was probably
positive.
like a month after we got diagnosed.
Mhm.
So the main symptoms were gone. We were feeling good. We were released by the county to go back in the public, and yeah, just randomly one day you're like, oh, my fingers are numb, and her toes started going numb, and then it would just happen randomly. And she would also have like random bad days come up too, where for me, I was sick for that first week. And then after that, it took me about 2 or 3 days to come back. And then I was pretty much back to 100%, except for the taste and smell. But with her, what was it, like 10?
Have y'all had any fatigue?
Yeah, extreme fatigue.
Extreme fatigue.
Like still?
Well, it's kind of,
yeah,
I'd say-
it's hard for me because I work nights, so it's hard to gauge it at this point now, like what's normal tired. But before I started working nights, I would say I was still having, like, I could still knock out in the afternoon and just take a random nap, which is strange.
Yeah, I'd say we're feeling more fatigued than normal. I'd say at 90% now, but it definitely did linger for a really long time. And
yeah, that's what I've noticed. My wife and I, that's what we've dealt with too. So that's interesting to know that you're experiencing that too.
Yeah. One other thing I was going to say is when we were experiencing our main symptoms, when the shortness of breath started coming down, I read online that like going for walks or riding a bike or something, doing some sort of cardiovascular activity helps. So we put on our masks and we went for a bike ride.
We could barely pedal.
Yeah,
we had so much muscle pain and fatigue, but we were like, let's get out of the house. Let's get some air. Let's try to get our blood flowing and not lay in bed.
We didn't go for very long. We made like one loop around the block, but
yeah, we had been doing like 20-mile bike rides leading up into this. And we seriously would go around the block and we'd come back and be like, oh God, that was exhausting.
But it did help with the shortness of breath. I felt like it opened up your lungs or maybe it pumped more oxygen into my system. So I don't know. I liked it. It helped. I would recommend that.
Yeah, it did help to if you're able while you're sick to get some kind of, rest is important, but also activity is important for for your physical health. Even if it's just as simple as walking, up and down the street in front of your house, if you don't want to venture too far out. Something that was a little awkward though is we would come across neighbors who would try to like talk to us, or and we were out on our bikes with the masks. We're like, we didn't want to tell people, but we have COVID, stay away, but we're just really trying to avoid all the neighbors and everything.
Taking steps back if they would come up and try to walk or talk to us. We'd be like, oh, okay, yeah, that's cool.
They probably thought we
Keep
were
the 6
super
feet.
paranoid
Yeah.
that they were going to get us sick, but it was that we didn't want to get anybody else sick.
Mhm.
So
What would you recommend for single people living alone who would get it?
I honestly don't know, because I feel like without the support of having somebody in your home who can understand what you're going through, but also kind of have your back and you have theirs, I would say, like I said, again, like leaning on community, and if you do have friends that are willing to drop stuff off, take them up on that. Like this thing ravages your whole body, and you've got to focus on getting better and resting and taking care of yourself. Don't stress about, oh, I don't want to bother anybody. But people are more than willing to help. We had just people that we had very casual relationships with reach out to us and say, if you need anything. So the helpers are out there. You know what they say, look and you will find the helpers. And there are people who are willing to go out of their way to help you out. So I think being single would be much more difficult, especially if you're a single parent and you don't have a co-parenting relationship, and say your children are, if they're positive and asymptomatic, which is common in children, or if they're sick. I couldn't imagine taking care of my children, taking care of myself, and, just trying to make sure things don't fall apart. But I think everybody has somebody that's close to them that can help them out, and definitely take advantage of that.
I'd say if you're single, just try to be, I don't know, clear your schedule. Don't try to get anything done. Don't try to get any work done, because we're self-employed. So like we could have been, I think I tried to work one of the days and I was like, nah, can't do it. We do photo.
Well, we work from home. He wasn't trying to work
no.
out in the public.
Yeah, we do photography and videography. So all of our stuff's done on the computers mostly, the editing and stuff. So I was trying to edit something one day and I was like, nah, I can't do this. So if you get it, just like clear your schedule for 5 days, maybe a week, and just don't expect to do anything. Don't feel bad that you're not doing anything, because I don't know. I thought that was the best way to get through it, is just sitting down and just being like, I feel like garbage right now. I'm just kind of ride this out and hopefully it gets better.
Yeah, you really just have to listen to your body. And that comes to if you're having, extreme symptoms that you feel like you can't manage at home, like listen to your body, like go see a professional if you need to. It really is a fine line, because, so many people go and it's too late. They've read, let's wait it out at home. And, unfortunately, by the time they get into the hospital, there's nothing that they can do. So.
Did the doctor help you all at all? Did you all go to the doctor's office?
No.
No, after my PCP refused to test me, I actually filed a claim through Kaiser Permanente. They're my PCP. I explained the whole situation to them, that they refused to test me, even though, I had all the symptoms, and they were quite flabbergasted by that. And I did request a change of my doctor because for obvious reasons, I don't trust that doctor anymore, the way that he belittled my concerns. And I have to say Kaiser was very proactive in solving the problem and listening to my concerns and making sure it didn't happen to somebody else. That was my main concern when I filed the complaint, was not that I wanted any kind of retribution or even an apology, really, is that if it was happening to me, who else was it happening to? That they were refusing to test, and then those people are going out. If I wasn't smarter than I am, if your doctor tells you you have allergies and you don't have COVID, most people are going to trust their doctor. Like, we're always told, and I trust modern medicine, and I trust doctors, and I trust our medical system, but I feel like they let me down. Yeah. And if I hadn't been smart enough to just listen to my body, I could have gone out and infected God knows how many people.
We actually did, though. That was on Tuesday. On Tuesday, she started feeling super, super sick. And that was our trip was Friday through Sunday. And then on that Tuesday, she was super, super sick. That Monday, we had booked a trip to the beach because this was when things were first starting to open up in California. So we booked a trip to the beach and we're just like, oh, we'll go over there with the kids, hang out at the beach. I know lots of spots that are private beaches and nobody's going to be there. Socially distanced should be good. And we get play in the water and stuff and it'll be a fun time. And then Tuesday, she gets sick day after I booked the hotel. And we're like, oh no, now we're going to have to cancel our trip. It looks like she has a day cold or something. She went in, got refused. They said it was just allergies. And we're like, all right, well, doctors know best. It's probably not COVID. And then the next day she was fine. Wednesday, she was fine. Thursday, we went to the beach. Friday, we came back. Friday, we started feeling symptoms again. So then that's when things started really hitting. That was that was my day zero, not Friday. That was kind of your day zero too. You had that one day and then there were like 3 days of nothing. So in those 3 days, we went to the beach. We were exposed to hundreds of people walking on the street. We were wearing our masks the whole time, but still, because of those doctors' negligence, we could have infected who knows how many people. And that's why like she filed the complaint, because like that's a serious issue. We could have potentially killed people. We don't know.
I was devastated when I was filing the complaint. I was embarrassed that we had broken quarantine. Like we had done everything by the book, and I felt terrible that I could have potentially not only infected my children, but my children's dad and their stepmom and, you know, everybody else that we come in contact with peripherally, my sister who's a nurse. Like it was, so I'm physically going through all this terrible pain and symptoms, but then mentally I felt like the biggest jerk on the face of the earth. Like it's hard to explain that feeling of like having to call anybody you've come in contact with and tell them like, hey, so I may have gotten you sick. And that is not a feeling I wish on anybody. And that's, you know, why we continue to be careful, because I don't want to do that again. Like it's not fun.
My apologies. I was asked to be in this role, but I've got to get off the phone because I've got to go somewhere else. So I'm going to leave. But I'd like to leave you with a thought, if I may be so bold as to do that. You all are lovely, wonderful people, and you have a huge sense of responsibility. And you know what? You did the best you could. You absolutely did the best you could. So enjoy the knowledge that you did the best you could for everybody, and be with that for the rest of your lives. And try to forgive what happened that you were not able to control.
I think we
go with that.
did a pretty decent job.
You did the best you knew how to do. And I'm so glad for you that you have that.
Thank you.
And I see that you're back, so I've got to go. And I apologize.
Thank you.
Yeah, so you all take care.
Thank you.
Yes.
Okay, so I just figured I would check in. I mean, we've been on for about 50 minutes or so, and just to see if anybody has had any questions about anything else. I see Philip has had to head out. I just figured I would check to see, and if not, it's 8 o'clock Eastern Standard Time. We could probably go ahead and convene. I think, did everybody have questions answered and learn something? And pardon me for having to step off for a few minutes. But I know Dory very well, and I know she's more than qualified to come in and speak and help.
Did anybody else have any questions or anything? Has anybody else here had COVID or?
I think they said no.
No, none of them? Okay.
Well, I hope it stays that way for you guys.
Yeah, it's not fun. I don't recommend it.
Definitely not fun. So, you know, absolutely stay safe. And it's a hard time right now, because it's a time when you want to be around people so freaking bad and you can't. But the best way to show that you love people is to not be around them.
Yeah, I think the end of March, I was folding laundry, and I was in the bedroom, and I was like, are we really doing this? We're really all staying home, and we're really all, this is kind of a crazy thing.
It's very hard when you're a very social person.
Absolutely.
Yeah,
And-
for sure.
Yeah, and it's hard. We do these events, and so we had to switch over to doing them on Zoom. And we had a board meeting last week, and it was like, oh, I got to see everybody. It was on our board that I haven't seen them since like,
Yeah.
February. And I was like, oh my gosh, I miss you people. And, you know, when you go out, you have to kind of remind yourself that this is this is like, you still need to sanitize, you still need to put on a mask, you still need to it's like, how long are we going to how long is this going to be the new normal?
Try not to think about the how long, because I think it's going to be a while.
Yeah.
And so I think most people have kind of reached a point where we're like, this is the new normal. I know everybody's sick of that phrase, but it truly is. And I think the earlier we embrace it and adapt, the easier it's going to be to get through this. The hesitation and the denial does not help it go away faster.
I don't think it's that bad either. Like wearing masks and stuff. Like I know in the beginning, lots of people still are, I guess, anti-mask, but it's less so here in California. But I know in the beginning, you'd go to the grocery store and there'd be 50 people that have masks on or not. Now everybody has masks on. It's weird if you don't, but there's still like normal conversations. Like I'll see people standing 6 feet apart, just having conversations with their neighbors or whatever, friends that they ran into at the grocery store. And it's like, I don't see anything wrong with that.
It's
You're still allowed to
new
be
normal.
Still allowed to be social. You just got to make the best of it.
Yeah.
Like anything.
Do any of you have an opinion about the use of face shields instead of masks?
So I will tell you my opinion because I have to wear one at work. From what I understand, they are best when used in conjunction with a mask.
Right.
Unless you're unable to wear a mask. I know some people cannot for various reasons. But from the training we received at work, it's basically these masks that we're buying at the supermarket, the gas station, online, whatever. Those aren't medical grade masks. And even surgical masks aren't really going to protect you that much. Obviously, it's better than nothing. Everything's better than nothing. But it is going to stop the splatter. Say you do come in contact with somebody who's not wearing a mask, or somebody who wasn't wearing a mask just walked down the supermarket aisle right in front of you, and now you're walking through their cloud of stuff. A lot of things can actually enter your body through your eyes. That's why I say, don't rub your eyes, touch your face, all that. So even though, obviously breathing in somebody's air is going to make you very high chance of being infected. Also, you can contract a lot through your tear ducts and, anywhere where any kind of liquid comes out of your body, you can get infected. So I would say it is an extra layer of protection. I know around here it's not something you see very often. I would think if you're compromised in any way, or you're close to somebody who is, there is no harm in doing it. Obviously, if you can wear a mask as well, that's going to give you the best protection. And they're not uncomfortable, so there's that.
No, I like the shield better. I use a face shield much, and I don't like to use it with a mask because it fogs up my glasses and it's hard to breathe and all that stuff. But it does sound like it needs to be both, and I don't know in this muggy weather we live in here in South Carolina, whether I want to deal with that.
So on my first night at work, I had my N95 and my mask, and I was texting him, and I'm like, I cannot see. Like, I'm trying to chart right now, and everything is all great. And so he actually went on Amazon and ordered this like no fog spray that you can spray on the mask on the inside, and it worked like a charm. I used it for the first time last night. No fog. Do you remember what it was called?
So I just typed in like anti-fogging spray. And I don't know. It was the first one. I think it was like $10.
Absolutely worked 100%. I went a full 8-hour shift with
and
no
does
fog.
It have to be, does the face shield have to be a certain length? Because some of them, the first set I got seemed to be kind of short.
I'm not sure about that. I don't feel like I'm qualified to speak on that. I would think the more coverage, the better, obviously. I think mine comes down to probably about my collarbone, maybe a little bit higher. But I don't know if we use different ones than you would standard buy online.
Yeah.
Okay.
I don't know much about the face shields, but I'd say always use it in combination with a mask.
Which she's saying she doesn't like wearing the mask, especially with the fog.
With the fogging and stuff. But I don't know. I think the masks protect you a lot more from breathing things in because I think it is airborne, isn't it? Right?
Yeah.
Yeah, but I thought the point of wearing the mask was to protect other people.
Yeah.
Yes, it is.
Do I have that backwards?
No, you're correct. You're
Yeah,
correct.
that is true.
Yeah, the problem is there's so much, anything that you read online, you can find 10 different
But what
studies or opinions on it.
Yeah, what I've been doing this whole time, I haven't paid much attention to the news, or like as much as an average person probably, but I'm just using common sense mostly. And I've been arguing when this was all happening, like started going on lockdown and stuff. One of my friends he kept flip flopping. He was like, "Oh, we need to be locked down." I was like, "No, we don't need to be locked down. This is all stupid." And I was just like, "Isn't it better just to be safe? Just
be safe.
stay at home, just use common sense, and don't listen to what you're hearing because." Everyone wants an answer. Like I worked for the news for a year and I was the national editor. So I was pumping out all the content that you see on TV, everything that wasn't the anchors, I was throwing that out there. And we would go back on things that we would say so much because people want the information like that. So when there's COVID and people know nothing about it, they're going to try to throw information out there. And the bad thing is people they stick to the first thing they hear.
Like when they told us that masks were useless,
Yeah.
and now
And
it's like back and forth. But I mean, wear the shield.
Yeah.
Absolutely wear
It's
the
always-
shield. It's not going to hurt you. So I would recommend
Yeah.
doing it.
where I was getting with that news thing is just use common sense. Don't listen to what you hear because people
It'll
stuff
change
coming
every
from this side,
day.
stuff coming from that side. It's just like, sure, listen to it, but then in the end, just use your brain and be like, oh, I should probably do this because it's better to be safe than sorry always.
All
You'd rather
right.
be extra safe than like, oh, I wish I would have been safe.
Yeah, I mean, take it from us who
Yeah.
made a slip up and had to go back. You want to be in the position that we were in. So definitely be as safe as you can. And
Right. Thank you.
I know they say that the mask is not effective for the individual wearing it, but if you look at people with compromised immune system, they wear masks. They were wearing masks prior to COVID. Whenever they went outside, whenever they came into contact with other people, they wore a mask. So they were wearing the mask to protect themselves. So not necessarily to protect someone else from getting something that they had. They were wearing the mask, or they wear the mask to protect themselves. So I know it's been said that the mask doesn't protect you, but I think in some part it does protect you, because if someone has a spittle, you have something covering your nose and your mouth, and it prevents that spittle or whatever from coming into you. Maybe not, it's not perfect, but it is preventing something from coming into you as well.
yeah, because the viral particles live in water droplets, and even
Right.
though the viral particles are very, very small, water drop. If I were to spit in his face, those are not. My spit is not very small. It will. So yeah, the virus could swim through the fabric and get up there, but more protection the
Yeah,
better.
it's just an extra layer. It's filtration pretty much. Like I was also very into fish tanks growing up, and you can run a fish tank with no filter in it. That's going to be a dirty fish tank because there's nothing in there catching the stuff pumping back into the tank.
Right.
Put a filter in there, a mask, it's going to help you. It's going to catch all the bad stuff in it, and it's not going to spew anything out either. It's like it helps you, it helps everybody else, and it's just a good thing in general. I think
It's just
keeps it cleaner.
being a good human. And
Right. And another thing, we need to change our mask. We can't wear a mask, the same mask all day, every day. You really do need to change them. And the cloth mask, they need to be washed. The disposable ones, you need to dispose of them.
yes,
I think a good thing to do is like probably have like 3 or 4 of them at least on hand.
it's on rotation.
Yeah.
What I do is I keep them in my car, and we're in Southern California, so it's super hot here. When I'm done, I just throw them on my dash. I always have one on my dashboard, and I figured it's so hot it's getting baked essentially. Stuff on it, getting baked out, and then once a week wash them, and yeah, that seems to be working. Well, I don't know. We got COVID, but
Well, maybe it doesn't work. I don't know.
Later.
it makes sense in my head.
But we know exactly where we got it. So I guess we'll see if I end up bringing it home again, and then maybe we can have a little update on people who get COVID twice. I don't know.
Yeah.
Curious
Right,
to find out.
Yeah.
You're working in an environment where it's prominent. For the everyday person, we're not. So
Yeah.
it makes a difference.
Absolutely. It would if I got it again, I don't know that I'd be shouting it from the rooftops, because you're right. It's a completely different scenario when, there is no maintaining 6 feet of distance from my patients that, when I'm helping them to the restroom or bathing them, changing their sheets, that that is out the window. And even with all the PPE, I think I'm at extremely high risk of contracting it again. So yeah, but that's not normal people's experience at all. Absolutely.
Right.
Let me read the woman that used to work in Charleston for us, what she said, just so that we can have another perspective too. She sent me a message, and she said, "This is my family's coronavirus story. This past March, we had a family of 7 diagnosed with coronavirus. At the beginning of the coronavirus outbreak here in North America, we had been concerned for my son's safety, as he works for the local police department. At this time, his department had not implemented any safety precautions for the officers. On a Wednesday, my oldest son came home with a fever and said, 'I really believe I have this new virus.' She said, 'I had a hard time believing that he would have had it. After all, there had been so few cases at that time in South Carolina. The next day, he went to see his doctor. After 10 days, his results came in. He had tested positive for the virus. My family had to go into full quarantine, as each of us had been exposed. Each of us, one at a time, like a bad game of dominoes, had all tested positive. I was the last to feel sick. I had just finished making dinner. I felt a wave of nausea and lightheadedness. I grabbed a thermometer and had a 99-degree fever. I knew I had had it. The next 6 days were filled with mild fevers, extreme fatigue, and horrible muscle pain. She said, after a few days, my fever had left. I had felt better. I was walking our dog. I was also able to catch up on some paperwork. Within 4 days of regaining my energy and strength, I had begun to wake up in the night with a cough. It was a terrible barking cough. It seemed that it came out of the blue. My doctor took my symptoms very seriously and prescribed asthma medication. Within the week, my pulse had started to raise and my O2 levels were dropping. I know she also had a pulse oximeter at home because she had talked about that. She said I was admitted into the hospital. They were able to stabilize my blood pressure and then sent me home. It was made clear that they did not want a positive corona patient in their ER. I feel blessed that even though the virus is both physically and mentally hard on our family, we all made it through the worst of the virus. Today, we still have some residual effects. Some members of our family still are unable to smell and their taste buds are not functional as they were before the virus. My youngest son feels like he has mono. We were told his immunity is still low because of the virus. I still have a mild cough and I react with mild irritations with coughing fits that can be helped with the continued use of my asthma medications. She said she was also prescribed the hydroxychloroquine. She said the pharmacy asked her when they filled it if she had tested positive, and she said yes. She had on gloves and a mask, and she said, "You have my card on file." And they said, "We cannot give you your prescription, even through the drive-through window. You have to have somebody else outside of your family pick it up, and do not come back until after your quarantine is finished." So they would not let her come back through the drive-through or anything to go get any of her stuff. So that was her experience.
Same thing happened to Alicia's
Ex-father-in-law.
Yeah.
Because he had been exposed to us.
So exposed to April.
Exposed to my daughter who tested positive, my 11-year-old. He went to go pick up a prescription at the same facility where I was turned away from, and they would not let him in the building to get his prescription.
First off, they refused to test him.
Because he had no symptoms.
Even though he had been directly exposed to someone who had come up positive. And then he went back there, same day or the next day to get a prescription? And they refused to give him the prescription because he had been exposed to positive people, even though they wouldn't test him, which is...
Yeah, so they thought it was so serious that he couldn't get his prescription, but not serious enough to test him. And so he really, really had to push to test. And my former in-laws actually had to file a complaint as well about the same facility and them not testing them.
It wasn't just like regular unnecessary, well, I guess no medication's unnecessary, but it was like life-saving medication.
Yeah, like he has an underlying condition that he needs to take medication for.
They were like, no, you can't get it.
Yeah, and they were just going to let him walk away without his medication because he had been exposed to somebody, but at the same time not test him. Fortunately, he did come up negative, as did his wife, my former mother-in-law. So luckily we didn't spread it too far.
Mm-hmm.
Very good. Anybody else have any other thoughts or questions? I don't want to keep us all too late. Then thank you very much, you guys. We appreciate you sharing.
Yeah, no problem.
And thank you all for being on the call. We will have, this has been recorded, so at some point we will go ahead and be able to put it up on the website. So if more people, if you hear of somebody or if you know of somebody that would like to sit and listen to a conversation, we'll have that available.
Awesome.
Thank you very much for doing this.
You're welcome. Thank you. I know I appreciated it because I was really eager to know what we do, what we
Yeah.
think, what will
Yeah.
help.
If you do add it to your website, could you add a backlink to our photographer website too?
Stop! Shut up.
I don't mind, sure.
Cool.
Stop
No,
it.
it would help out.
He's so ridiculous. I know business is hard right now. So.
Absolutely.
You
Absolutely.
bet.
Yeah.
Ay, ay, ay.
Thank you.
Thank you.
Thank you guys so much.
All right. Thank you guys. I
Have a
appreciate
good
it.
night.
Bye.
All right.
Bye-bye.
All right. Bye-bye.